Hi, Dr. Harrison here, and today I want to talk about acupuncture. I became certified in acupuncture a few years back for one main reason, and that was because I had patients coming into the office and saying, "Do you know anybody who's good at doing acupuncture?" And I didn't really know any acupuncturists off the top of my head, and I would say, "No, I don't really know anyone," and they would question, "Well, what do you think about acupuncture?" And I said, "Well, I don't know a whole lot about it, other than, I have talked to some patients who've had good results with it in the past, and I'm all for anything that helps you. So if you want to try acupuncture and you go and it's helping you, then I'm all for it." Okay, great. So I had people coming in repeatedly asking me that same question over and over and over again. Finally, I decided, why am I, not taking advantage of this opportunity? Maybe I should go and get the certification myself, explore acupuncture, find out what this acupuncture is all about, and bring it back to my patients. Well, that's exactly what I did. So I talked to some colleagues who were certified in acupuncture. I said, "Where did you go to school for this?" Well, unfortunately, I found out it was in Lombard, Illinois. And so for a year, 1 weekend a month, I flew back and forth to Chicago, and that's where I became certified in acupuncture, because I heard this was where the guru was, or the man who actually taught the best way of doing it. And I really felt like I had a good, well-rounded education there. A lot of hands-on. If you're going to be inserting needles into your body, or having needles inserted into your body, you want to have somebody who, really was taught well how to do that. Well, we practiced on each other every weekend for a year, and we actually had to insert needles into every acupuncture point in the body multiple times. So, very well-rounded education. I just want to assure you that this isn't something new to me, that acupuncture needles I'm very comfortable with. So the other thing about acupuncture is a lot of people get nervous about the needles. Well, these needles are about as fine as a hair on your head. And typically, I would say 8 or 9 out of the 10 needles I put in, most people rarely even feel it. If anything, it's minimal discomfort. Even people who were previously afraid of needles or getting shots at the doctor's office, they say, "Oh, that was nothing." So don't be afraid of the needles. There's a great benefit that can be had from acupuncture. And just a little bit more information, general. Acupuncture is a science and art of using acupuncture points, which are along meridians in the body. And we've got 6 meridians on each side of the body. And each of those meridians contains a certain number of points, and generally they coordinate with an organ system. So for instance, we have a bladder meridian, we have a liver meridian, we have a gallbladder meridian, and so on. So we have the heart meridian. So we have all these different meridians, and along these meridians we have points that have been mapped out over the years. And acupuncture is an art that's been around for they definitely have significant dating back 3,000, but even back to 5,000 years ago. So this is not new stuff. It's recognized by most insurance carriers now, and so there's a lot of efficacy to be had with how effective acupuncture can be for certain conditions. And so what happens in these energy pathways is they can become out of balance. Whether, again, it's due to emotional, physical, or chemical stress placed on the body, these meridians can be thrown out of whack, I call it, or out of balance. And we have a computerized system in the office that will measure them and tell us where the imbalances are. It will actually recommend certain points to hit with the needles to help balance that energy in the body, or qi. And a lot of people have heard that term, and qi refers to the energy flowing through these meridians. Well, when we hit these acupuncture points, we're trying to balance the energy, or the qi, and in doing so, we downregulate or calm down certain systems, and we calm down symptoms. So anything from colds, flus, neck pain, back pain, headaches, extremity pain like shoulder pain, tendinitis, bursitis in the knees, hips, shoulders, all respond beautifully. And outside of that, even emotional type issues, we use acupuncture for smoke cessation, for appetite suppression, had very, very good responses with depression or anxiety. And a lot of times we'll do auricular therapy for that, and we use really tiny needles for those. So if you're suffering with any of these types of conditions, again, neck pain, back pain, headaches, anxiety, depression, maybe you want to stop smoking or lose weight, acupuncture can be a great way to do that. And if you have any other questions, feel free to call the office. We'll set up a free consultation, find out what your situation is, and see if acupuncture is a good match for you. Or you can go to our website, orlandochiropracticrehab.com, click on the acupuncture section, and there's a really great video you can watch. We'll explain a lot more about acupuncture and what we do in the office. I hope this has been helpful, and I look forward to seeing you soon.